Maricopa County and the Superior Court of Arizona teaming up to host a Behavioral Health Expo. It's set for May 6th at Pilgrim Rest Baptist Church in Phoenix. The expo is designed to focus on mental health awareness, including mental health justice. And here now to talk more about all this is Joseph Welty, presiding judge of the Maricopa County Superior Court, and Dr. Carol Olson, chair of the Department of Psychiatry at Valleywise Health. Good to have you both here. Thank you so much for joining us. Doctor, we'll start with you. This is a stand-up behavioral health expo. What's this all about?
Well, I think in general the community is often not very well informed about how to get behavioral health services for, say, family members or even themselves who are having a difficulty with their mental health. And so the idea was to try to do a presentation for free in the community with a lot of different agencies that offer behavioral health services so that people understand a little bit if they've got a family member who's going through some difficult times and they're not sure where to turn for help. This would be a setting where they could find out how to do that.
Get that information out there. Mm-hmm. As far as Judge, focusing on mental health justice, I saw this referred to a number of times. Mental health justice, what does that mean?
Well, I think what the term is really referring to is a focus by the criminal justice system and county leaders on individuals with behavioral health issues who are involved in the justice system, and how it is that we can do a better job collectively in partnering with the behavioral health system to guide those folks through the system better for better outcomes. We are focused on concepts of public safety, and central to public safety is the concept of recidivism. Behavioral health treatment is a strategy to address recidivism, just as many other strategies in the criminal justice system. And what we found through a task force that we've put together is that if we can help the community have greater awareness of behavioral health treatment, then folks are more likely to receive treatment. They're more likely to avoid behavioral health episodes, which result in involvement in the criminal justice system. This is a step toward avoiding people from entering the justice system on the front end. Diverting
them from the justice system.
Or hoping that we don't have episodes that even create diversion. Where we have diversion, where we have episodes, we're also working on diverting folks out of the justice system, because treatment is a better option for many of those folks, especially low-level nonviolent offenders.
And among the information I saw here, trying to get that 988 mental health line, the 211 Arizona Crisis Resource Line, what are those?
So the 988 number really was intended to be an immediately recognizable number for mental health issues, emergencies, or even non-emergencies, the same way that people know the 911 number. So it was introduced several months ago, and it was an effort to get it more widely known so that people were not struggling with these situations with sometimes in crisis, say in the middle of the night, or at other times when maybe their regular doctor wasn't available, that people knew a number that they could call and get some help.
Yeah. And Judge, back to you. I know that you're very much involved in this mental health task force, pretty much at the ground floor here. What is that, and what was it designed to do, and how does that play into all of this?
So the Mental Health Task Force was formed in 2019, and I chair it along with Supervisor Bill Gates in Maricopa County. The design of the task force is really to bring all the stakeholders together. We've got prosecutors, we've got defense attorneys, we've got representatives from the sheriff's office, we've got representatives from the correctional health services, the medical provider within the jail, and then we're partnering with behavioral health partners from around the valley. We took a 2-year period to study every step along the way, from a 911 call to prison reentry services, and tried to make a determination as to where folks with behavioral health will have trouble at those particular nodes, and are attempting then to go back into each one of those things and where can we provide assistance? Where can there be a soft handoff of someone who's suffering from a behavioral health crisis? Folks with suffering from behavioral health issues spend way more time in the criminal justice system than those that don't. And in fact, the jail population is vastly overrepresented by folks with serious mental illness, with much higher percentage numbers in the jail than in the general population.
Knocking down those silos is a big thing.
The data exchanges and cooperation to get out of those silos, recognize the challenges in the justice system and the challenges in the mental health community, and try and bring those things together.
And last question, Doctor, just simply learning how to navigate behavioral mental health, the entire system, that's a project and that needs awareness as well.
Absolutely, because if you've ever had a family member who has a mental health issue, it can sometimes be really mind-boggling to try to get help, calling many different places, trying to find a place that has an available appointment, for example. One of the advantages of having the 988 number is that you are calling the appropriate emergency services versus just calling 911 and getting a police response, when we've seen, nationwide that sometimes that can have a very tragic outcome. We want to use the police for when the police are needed, and we want to use mental health professionals when mental health professionals are needed.
Which goes back to mental health justice. May 6th, Pilgrim's Rest Baptist